Disclaimer: the video you are about to view is an invasive medical diagnostic procedure, a liver biopsy. Please be aware that the video has graphic scenes and images that show a real liver biopsy procedure in full color and close-up. The graphic content of this video may be offensive or traumatic to non-medical viewers. By continuing to view and listen to this program, you have agreed to accept full responsibility for your actions, relieving Visionary Health Concept of all responsibilities for any negative reaction or occurrence you may suffer as a result. Please press stop on the navigation bar below if you do not wish to view the above described procedure and proceed to the next set of slides in this program. Prior to watching the biopsy video, it is important to know that several steps occurred beforehand. In a previous office visit, Dr. Dietrich discussed the biopsy procedure with the case study patient in sufficient detail. Careful attention to anxiety and pain management issues, as well as the substance abuse history concerns of the patient, were discussed. Upon Dr. Dietrich's recommendation, aspirins and non-inflammatory pain medications had been discontinued and a blood test was performed 1 week prior to the procedure. The case study patient was accompanied to the hospital for the procedure by a reliable person who was committed to stay with her for an additional 24 hours. After ascertaining that there were no contraindications or conditions that might increase the risk associated with the procedure, Dr. Dietrich discussed the procedure once again with the patient and secured a signed, informed consent form. The patient changed into a hospital gown and was administered sedation and pain medication. The providers then confirmed the patient was comfortable and ready to begin the procedure. Dr. Dietrich will now describe the ultrasound and biopsy procedure in detail.
Okay, this is a pre-biopsy technique where we localize the liver with an ultrasound machine. We find out where the gallbladder is and the other vital structures that we can identify, and we make sure that there are nothing vital in the way of the needle. So this is an ultrasound guided liver biopsy. We make a mark on the side of the ribs where the best spot is, and then we go ahead and anesthetize that site and go ahead with the biopsy. Percussing the liver is the classic method of localizing the liver before liver biopsy. Now we have ultrasound techniques which allow us to do an even better job, but we oftentimes reinforce the ultrasound with our own percussion so that I can be comfortable as to exactly where the liver is and that the mark on the liver is the right spot to do the biopsy. That's a sterile procedure, so we put on sterile gloves. And we create a sterile field so that there's no contamination of the small biopsy site. And then proceed to cleanse the area with iodine solution to make sure that the area is sterile. A little local anesthetic, typically lidocaine, same thing we use for the dentist, is applied first into the skin and then underneath the skin to anesthetize the area and the track that the needle is going to follow into the liver. We go a little deeper with the lidocaine all the way into the liver because there are nerve endings on the capsule of the liver. Now we make a small stab wound with the tiny scalpel to make the needle slide more easily. There's no pain involved in this, as the skin is totally been anesthetized by the lidocaine that we used before. Now the biopsy needle comes in various shapes and sizes. The one that we prefer to use is called jamshidi, but there are various other kinds of biopsy needles that are used in different hospitals. It's just a regular hypodermic needle, basically, with a slightly larger barrel. We put a little saline in to cushion the liver biopsy. We put the needle through the skin. We ask the patient to take a small breath in as I put the suction back on the needle. And then we make one little pass into the liver and then let the patient breathe, and the biopsy's over. Afterwards, we'll put a bandage on, usually no bigger than a Band-Aid is fine. People will stay in the hospital 3 or 4 hours or 5 hours for observation to make sure there are no complications like bleeding. And and that's it. Usually the biopsy results are ready in about a week, and that's fairly typical